participating in webinar Lifespan Respite 101. My name is Jill Kagan, and I am the Program Director of the Arch National Respite Network. Before we get started and before I introduce our guests and presenters, I just wanted to share some logistical information with you. Right now, if you're hooked in correctly, you should be seeing the screen saying waiting for Lifespan Respite 101.
Yep.
Our organizer is Emily Turner from the Chapel Hill Training Outreach Project, and I will be your facilitator as well as presenter. The first thing I need all of you very much to do is to please mute your phone lines by either pressing the mute key on your own phone or pressing *6. Uh-oh. Especially if you're on a speakerphone or a cell phone, because the background noise can be very disconcerting. And we may have as many as 300 people on the call, so keeping mute is very important. And what we will do, the other thing is, please do not place your call on hold. That's different than mute. And sometimes we would hear your music or other background information that your agency might have running when the hold button is hit. So don't hit your hold button. If at any time you're having trouble viewing the slides or your control panel on your screen or other technological problems, you can type your question in at the bottom of your control panel, and Emily will get back to you in writing there and try to help you out. If you don't see your control panel, you should have at least a little grab tab in your right-hand corner that's kind of a vertical bar with some buttons on it. And at the top, there's a double arrow. You can hit that double arrow to minimize or bring up that control panel. And that control panel will be
mute off.
Type in your questions or type in your issues. We are going to keep this call muted for the entire time, again, because there are so many people.
Jill, if I can interrupt real quick.
Yes. Mm-hmm.
We have some people unable to call in, telling them that they've exceeded the allowed number of occupants.
Can they try either? They can't call in on either number?
Nope.
Did they try both numbers?
I'll ask right now.
Okay. I didn't know we had a maximum on our phone number. Apologize. While she's checking that, I'll go on. Don't worry if you missed some of the presentation. The entire webinar, of course, will be archived on the ARCH website in the next day or two, as well as the PowerPoint slides and any background materials will be posted there.
Mute on.
As I said earlier, we will take questions at the end of the last presentation. You can type in your question at any time in that chat box or question box that you see at the bottom of your control panel, and we will get to them. If for some reason we run out of time and we don't get to your question, you'll have the opportunity to email it to me,
mute off.
Or we'll definitely get back in touch with you with an answer to your question.
Jill, it's Emily again. They have tried both numbers.
Okay, can you do me a favor, Emily? Can you, I don't know if you can do it as a participant. If there's some way to reach the budget conferencing operator,
okay,
and ask if there's any way to increase the number of people. I had no idea that was a limitation. I have to apologize to all those folks who can't get on. Okay, we'll get started then.
Mute on.
Again, this is Lifespan Respite 101. We're lucky to have with us today Greg Link, who is the Aging Services Program Specialist at the U.S. Administration on Aging. He's also the Federal Program Officer for the Lifespan Respite Care Program. We have myself, Jill Kagan, and our list of presenters from our state lifespan programs, Mae Martin, who's with the Lifespan Respite Program in Oregon, which is housed in the Department of Human Services. Marcia Alber with the Nebraska Lifespan Respite Program in Department of Health and Human Services in Lincoln, Nebraska, and Roseanne Percival with the Oklahoma Respite Resource Network, housed in the Developmental Disability Services Division in Oklahoma City, Oklahoma. And we're going to shift right now to our agenda, and I'm really very delighted that Greg was able to join us today, and he's going to provide us a welcome and give us some background on the AOA's involvement with Lifespan Respite. Greg, go ahead.
Thank you, Jill, and good afternoon, everyone. And thank you all so much for the tremendous interest that that we're seeing across the country in the Lifespan Respite Program. Whether you are a current grantee of the Federal Lifespan Respite Program or are in a state who is considering perhaps applying for the Lifespan Respite Care Program this year or developing programs for the first time, I think you'll find the information presented in this webinar most useful. AOA has been involved in implementing the Lifespan Respite Care Program for just about a year now. We know that the program was first authorized back in 2006, and in 2009, Congress appropriated the first round of funding in the amount of $2.5 million, and AOA was given responsibility for implementing the program. AOA envisions Lifespan Respite Care programs to be integrated, coordinated systems of accessible, community-based respite care services for family caregivers of children and adults of all ages with special needs. AOA really sees these programs facilitating coordination between multiple respite funding streams, reducing duplication of effort, and assisting in the development of respite care infrastructures, both at the state and local levels. So I hope that over the next hour and a half or so, you all will get a very good flavor for some of the model approaches that have been going on around the country, and will take away some real tools and strategies for implementing and expanding and building upon your programs already. I'm very pleased that we have the Arch National Respite Center as a technical assistance provider to support the development of Lifespan Respite Care programs around the country. And this is the first of what looks to be a series of webinars on various topics that will be of interest to the field as these programs continue to develop in the years to come. So with that, I say welcome and look forward to hearing questions, and I'll turn it back to Jill to get the substantive portion of this webinar underway.
Thank you so much, Greg. Again, we're really delighted that you could be with us today. Moving on now, I know all of you have some relationship to the family caregiving field or are family caregivers yourselves, but the new numbers that just came out from the most recent survey of the National Alliance on Caregiving and AARP now tell us that there are well over 65 million unpaid family caregivers in the U.S. And that number now includes also caregivers who are caring for their children with disabilities and other special needs. We also know that these millions of family caregivers are providing 80% of the long-term care in our nation, and that's really a staggering number. If the government had to cover the expenses for providing this home and community-based care, it's been valued at over $375 billion a year. That's more than we spent on Medicaid in 2007 and more than we spent on Medicare as well. What's very interesting, however, is that, and even though we know that the issue of caregiving for the aging population is certainly a very large one and a growing one, as we see the aging of the baby boom population. But I think a lot of people don't realize that the majority of family caregivers are actually caring for someone under the age of 75. In fact, it's now 56% of people under 75 are at home with a family caregiver. And of these, 28% are between the ages of 50 to 75, and 28% are under age 50. Again, these new numbers include caring for children as well. So I think that's a fairly significant thing to keep in mind, that these issues are certainly now lifespan more than ever. And as Greg said, many of us know what respite means. It's a temporary break from the ongoing commitments of family caregiving. It's an opportunity for the provider to go shopping, go to church or synagogue or mosque, or tend to their other family members. Or it might be a break for a provider who's in an emergency situation and has to deal with their own emerging healthcare crisis or a housing crisis or some other emergency and simply needs a safe haven for their loved one in an emergency situation. But when we're talking about lifespan respite, I really want to emphasize that we're talking about infrastructure. We're talking about systems. And in fact, the law defines lifespan respite as coordinated systems of accessible, community-based respite services for all family caregivers, regardless of age or special need. So this is really at the heart and core of what lifespan respite is all about. Again, it's also not a new concept that just emerged recently. There have been state-funded, statewide programs up and running since 1997. The first program, in fact, was started in Oregon, and we're fortunate enough to have someone from that state today tell us about that program. And it was soon followed by other programs in Wisconsin, Nebraska, and Oklahoma. In more recent years, the states of Arizona and Texas passed legislation also authorizing the establishment of statewide lifespan respite programs. They've been, acknowledged by and highlighted by the National Conference of State Legislatures, by the National Governors Association. So they have been recognized as models for making respite more accessible and available to families. And as we're going to talk about more at the end of the presentation, because of the new federal funding that we have through the Lifespan Respite Care program, we have 12 new federal grantees. I very frequently get asked, why do we need these lifespan respite systems? We have respite funding, for certain populations at certain times of the year, but that's just exactly the problem. We have a myriad of programs that are making respite available, but very often in a fragmented and not very easily accessible way. Many programs have confusing or restrictive eligibility criteria that limit qualified folks to those who have very distinct disabilities or chronic conditions or fall into very specific age categories, or they need to meet very strict income guidelines. So the eligibility criteria are somewhat of a problem for each of these distinct programs. Of course, affordability issues are always major, especially when you're talking about families that are providing care at home. Some of the medical issues that are related with providing this care can be very costly. They can really diminish a family's resources, and so respite becomes a luxury that falls to the bottom of a list that a family just simply can't afford to pay for, especially if they don't qualify for any of those restrictive programs that I was talking about earlier. But we have also found that in many places, even when families can afford respite, there are just not enough providers, or there are not enough providers who families feel are reliable or are available in the evening or on the weekends, or for specific, who are trained to deal with specific conditions or disabilities. So the provider issue is really, the provider shortage issue is really a very big barrier to care. And we also hear about family caregivers who are concerned about who it is that's providing the care. How are they sure that this person is qualified, that the person is trustworthy, that their loved one will be safe when they're at home? So that remains a big issue. But this bureaucratic maze of funding streams and services that I was talking about is really at the forefront of what Lifespan Respite is trying to resolve. And all of these programs, as you can see from this very short list, and this is not at all an inclusive list of possible federal and state funding sources, but it gives you a general idea of where funding sources can come from for respite. By far and away, Medicaid waivers provide the largest source of federal funding for respite. But again, I'm sure very, many of you are familiar with the fact that in your state, for example, you may only have a Medicaid waiver for children with autism or adults with traumatic brain injury, or just for kids under 18 with developmental disabilities. So there are, again, these Medicaid waivers are also generally restricted to particular categories of condition or to specific age groups. And above all, because they're capped, there are very long waiting lists for these programs as well in many states. The National Family Caregiver Support Program, which we all hailed as excellent back in 2000 because it was the first federal program that recognized that family caregivers were deserving of some special national attention and support. Also very important critical funding stream for respite. But because it, up until now, has been perceived as primarily a program for the aging, though that certainly has changed over the years as the eligibility categories have expanded, it still doesn't reach all the gap populations or the people who may not qualify for it or the Medicaid waivers. There are block grants to states, for example, that states may not realize have the potential to provide some funding for respite, either to pay for emergency respite, such as TANF can do that. Children's mental health systems change grants can pay for respite. But again, respite is simply an allowable use of the funds. States don't have to use those funds for respite, and more often than not, they're not doing so. So by having Lifespan Respite, it helps identify these potential additional sources of funding. There's some more listed there, categorical funding streams, or state respite or family caregiver support programs. If they're not being used to the fullest extent possible, a Lifespan program can make sure that that happens. Now again, all of these Lifespan Respite Care programs came into existence to deal with that list of barriers that I put up earlier. And these are some of just the common characteristics. They all differ a little bit in their infrastructure, how they're organized, who the state agency is, but they do all pretty much share in common these specific characteristics. And the first one, of course, is to identify the existing respite resources that exist in that particular state and put them together in a coordinated fashion so that it's much more readily accessible to families and reduces the maze that families have to navigate to find out what they might be eligible for or where they would find the dollars and the providers. By doing this, then, the state can then more easily identify, well, where are the service gaps that we have? Who are the families who currently don't qualify for any of those funding streams that we are currently using? And when they've identified those, then they're able to maybe look at some other funding sources that exist in the state and apply them to the gap population, or start to build and create new respite services for those populations. Now, this is unique to the Lifespan Respite Program. This piece in recruiting and training providers, which is another critical characteristic of programs. The other programs that I mentioned before all have the ability, they list respite as an allowable funding source, but they don't necessarily allow programs to do these very specific things that Lifespan, in fact, is required to do. On the next slide, you see that providing public awareness information is still a major component of all of our state Lifespan Respite programs. And this, even though we all know what respite is, and the national awareness about family caregiving, I think, has grown tremendously over the last decade, but there's still a huge gap in what families know about and what they think or they might be eligible for. Even from this last survey that the National Alliance on Caregiving did, well, the one they did in 2004 found that only about 5% of the family caregivers that they had identified nationwide were actually using respite. And why they didn't elaborate in that survey on why those families weren't accessing, but we can guess that it has a lot to do with the barriers that I talked about earlier. This percentage, forfortunately, has grown to 12% in this most recent survey that just came out in 2009. But that still leaves, 88 to 90% of family caregivers who are not getting respite of any kind, despite what we have in place currently. So the ultimate goal, of course, of Lifespan Respite and what all the programs are doing that are up and running currently are connecting families with these respite payment resources, with providers, and with training to allow family caregivers to really have the respite that they most want and need by being more knowledgeable about the services that are out there and how to find them. Now I'm going to turn this over to our much more knowledgeable folks who have been out there doing this in the field for quite a long time now. Our first presenter, again, is May Martin from Oregon, and I'm handing over the mouse to her at this time, and she can start doing her presentation. Thank you, May.
Thank you, Jill. I don't usually know until after, unless they say something. I know. I'm sorry, I'm not seeing my arrow. The recording again. I don't see why not. Going back.
May, would you like me to do your slides for you?
Why is it going backwards?
I don't know. Do you want me to do your slides for you? I'll bring it back.
Please do. There was a joint effort from many partners and advocates all over Oregon, starting with a statewide respite conference in '92, sponsored by the Oregon Developmental Disabilities Council, to a pilot project in 17 counties in '94, to the drafting of a respite bill in '96, and the final passage of the bill in '97. The law directs the Department of Human Services to assist counties in the development of community-based lifespan respite care networks. And then by 2001, DHS had a contractual agreement with 22 local agencies to be respite care central points of contact for families, regardless of age, income, race, ethnicity, special need, or situation. The law also requires DHS to appoint an advisory council to the program, assisting with the overall program goals and benchmarks.
You ready for the next slide?
Yeah. So these are the core services for our program, and they do fit in with the characteristics that Jill mentioned earlier. So I won't read each one of them. And truly, the work would not be possible without local partnerships and guidance with the program planning by the network Community Advisory Council. Local partners and council members do help with promoting program awareness and advocacy in their community. Next one, please. So this is our data for 08-09. It does fluctuate between the youngest and the oldest population, but they represent the majority of the families with those individuals that are who are being served. Next one. And this is by special needs. The 3% of no disability or special needs that you see there represents the siblings of children with special needs who may be attending some kind of respite event with the family. So the parents can actually have a complete respite opportunity. Next one, please. Okay, so what do we do in the area of provider training and recruitment? The local networks can assist families with the process of choosing a respite provider using their own maintained database, or they can also use the statewide registries, which are maintained by the Home Care Commission and the Child Care Resource and Referral. Networks recruit providers through their involvement with local community activities, such as attending the health fairs, conferences, career and volunteer fairs, other local boards, etc. Recruitment is also done through their continuing effort of connecting and developing partnerships, such as with the Educational Service District, the higher educational programs, such as the Early Childhood Intervention Program at the University of Oregon, which also partners with the Department of Education and Center for Excellence in Developmental Disability Education. Training is always encouraged. One local network even provides scholarships to respite providers. We're always identifying and exploring training available through various agencies and advocacy groups to make sure we serve all different populations. Next, please. So for the this biennium, that's the funding for 22 contracted networks, which is from the state general fund and a Medicaid match fund. It is being used exclusively for program development and staffing. And again, the local advisory council should assist the networks with the local program planning to make best use of the funds. Next, please. For the actual respite stipends with state dollars, we have funding from the DD Family Support Services, the Commission on Children and Families, and the Oregon Project Independent. Many Lifespan Respite networks also depend on private donations and foundations that they generate locally to serve families who don't qualify for publicly funded programs. One network has a cooperative system for family caregivers of both older adults and children. Caregivers can bank their time by volunteering or paying $5.50 an hour. Next, please. And these are the federal funded programs with respite dollars. One network from the Community Action Agency was able to, it's exciting to see, was able to receive some stimulus funds this year to help with the employment of respite providers in 2 counties. That's all I have. So I'm going to turn it over to Marsha from Nebraska.
Thank you very much, May.
Thank you.
And Marsha?
Thank you. Nebraska's program, let's see if I can get the... Jill, do you want to do my slides too? They're not...
Sure, hold on one second. One second, sorry for this problem here.
Why? Huh?
I can't see my arrows at the bottom.
No, I've got it for you.
Okay.
Sorry about that. Okay, go ahead.
Okay. Nebraska in 1999, our state legislature passed the Respite Care Act that established the Lifespan Respite Services program here in Nebraska. It started out with the development of the Lifespan Respite Network, and that network has developed a statewide system to provide public awareness and coordination of community respite services. In 2001, Nebraska legislature added Lifespan.
I'm sorry, we can no longer hear you.
Oh,
Marsha?
yes.
Marsha, are you still there?
Yes, I'm here.
Okay, we couldn't hear you for a minute.
Oh, okay. I'll lean into the phone here. I'm sorry. The Lifespan, in 2001, the Nebraska legislature added the Lifespan Respite Subsidy Program to provide funding to caregivers to purchase Lifespan services. And they charged the Department of Health and Human Services to administer that program. Next slide. Currently, Nebraska is, this is a map of our current areas. We are divided into 6 areas for the Lifespan Respite Network. And the network, DHHS can contract with agencies in each of those areas, for-profit, private, or public agencies, nonprofit agencies. We currently have an area agency on aging, a public health department, the YWCA, a Health and Human Services Agency partnership, which is housed at a community hospital, and a community services agency, and they have 2 contracts. Next slide. Each regional entity is responsible for, and I won't read those, but to create a single point of contact within each geographic area to provide information and referrals regarding respite resources. We have a 1-866 respite number, and on that number last year we received over 5,800 calls. They're responsible for recruiting and screening providers, paid or unpaid, and they do state APS, CPS checks, criminal history checks, and sex offender registry checks. And we currently have 1,081 providers, both agencies and individuals. Individuals, there are 830, and 251 agencies. They assist families and caregivers in identifying respite needs and resources. They match and link families and caregivers with providers and payment resources. Increase public awareness for respite and provide community outreach by involving interested stakeholders and build on existing resources. Increase access to respite resources by recruiting appropriate providers and promoting and expanding the respite services in their area. Each area receives $25,000 each year to develop new or expand existing respite programs. Create an advisory committee to in advising the Lifespan.
I'm sorry, are you on the next slide? Or?
No, we're still on the same slide.
Oh, okay, thanks.
They assist in developing, they have to create an advisory committee which helps them in determining what the needs are in their service area. And they meet with them at least quarterly, and some of them more often. They provide participation in our quality assurance program, and they make training available. In 2009, they made made available over 40 workshops and conferences to about 4,700 participants in the state. Next slide. Training. They have to ensure availability of both caregivers and providers. The local network is responsible for offering opportunities such as for training, and the core things that they have to offer is what is respite care, activities of daily living, confidentiality, the Nurse Practicing Act, philosophy of family choice, client direction, family provider issues. And they do this by means of workshops and video conferencing. They use their telehealth network through the hospitals and public health departments. They may pay for caregivers and providers to attend a diagnosis-specific training and or conference. They develop training in coordination with the community colleges. They may pay for nursing assistant classes for both caregivers and providers, and they partner with several agencies and organizations to sponsor training such as Alzheimer's, autism, the area agencies on aging, the educational planning regions, behavioral health programs, county extension, and independent living centers. We also have a teen mentoring program. Next slide. The Respite Subsidy Program, which was the second half of our act, was developed to provide assistance to the caregivers, and we pay up to $125 a month for those that are eligible. Eligibility categories include lifespan, special need. We don't go on diagnosis. We go on on what the need of the individual is, and then you have to have continuous ongoing care. Income limits is 312% of the federal poverty level. Disability categories, you can see over here that we, on the side of my screen, that we do serve a lot of different disabilities. And next slide will show you the age groups that we serve. Children with special needs, which is birth to age 18, we serve 41% of the individuals served are 41%. Adults with special needs is 19%, and the elderly is 40%, and that's age 60 plus. Some of the statistics for state fiscal year 09 is that we served 998 persons on the Respite Subsidy Program. With currently, we have 596 respite clients receiving respite services. The program, the subsidy program, received 474 new referrals last year. Clients eligible for other programs are also referred by our case managers to those programs, as well as the respite network if they contact them. Providers are provider choice. Clients have the choice of their own providers. They may use relatives as long as they're not the legally responsible relative, such as a spouse or a parent of a minor child. They do not have to, if they don't have a provider, they can contact our respite network using the 1-800 respite number, and the respite coordinator will assist them in finding a provider. The client is reimbursed, or they may choose to have DHHS pay their provider directly. And they submit monthly billing for the respite services. Annually, Nebraska receives funds from the tobacco settlement, funds of $255,000, state general funds $210,000, and $184 federal Medicaid match, and $50,000 from the IDEA funds through education. Each agency receives $75,000 for the network activities and $25,000 for their special projects. And the remaining of the, funds, and this is used for administration purposes. State funds for the Respite Subsidy Program is $810,000 from the Tobacco Settlement Fund. Nebraska also receives some DD funds, but that goes to the DD program who provides respite to them. They get funds through from general funds for that. And behavioral health also receives some general funds for respite, but their respite is a little different than ours. It is for the individual, for them to get away, not necessarily for their caregiver, and the individual doesn't necessarily need a caregiver to receive respite funds from the behavioral health program. Our federal funding sources, is there another slide? We we get funds into Nebraska through Medicaid waivers, the Social Services Block Grant, Title III of the Older Americans Act, and family caregiver support, maternal child health, Title V, foster care, adult protective services, subsidized adoption, and just straight Medicaid through our personal assistance services and skilled nursing care services, temporary nursing home, and temporary nursing home care. All of these programs do receive those funds directly, but our coordinators assist families and clients in accessing the appropriate funding sources when they're talking with them. And I guess I'll pass it on to Roseanne.
Are we ready to go here?
Yes. Okay, Roseanne.
All right.
Do you want to do your own slides, or would you like me to do them for you?
Well, you know, the little bar down there is not showing.
Huh.
Because when you have your little arrow, it goes below where I can see. So if you'll do mine,
Okay.
we'll make it a sweep across the board.
Okay.
Happy
to do it.
Okay. Oklahoma is a statewide partnership of public and private agencies, and we are not formalized. We're not a 501c3. It's just a group with a passion for respite that's met now for 10 years and issued vouchers for 10 years. But our partners include every really kind of major state agency: developmental disabilities, aging, mental health. Oh, aging is on there twice. How about that? Maternal and child health. Next slide. And we're not really locally or regionally structured. We do a statewide program, and we currently serve all 77 counties in Oklahoma, but we rely on our statewide information and referral system in Oklahoma called the Oklahoma Area-Wide Services Information System. We do have a designated Respite 800 toll-free number now. And through OASIS, they've been around for a long time, had a really good reputation with the state. People were used to dealing with OASIS, and so it's a really good way to have an intake point for people to call for respite care. And we also link all of our training through OASIS so that they can link families up with the training opportunities that we've coordinated. We'll talk about that in a little bit. Next one. Our caregivers are eligible for $200 to $400 every 3 months as long as funds are available. And we use OASIS. One of our good services is that when they call OASIS, not only are they getting respite information, but they are our information referral system that developmental disabilities, family support services, aging, and other agencies within our state use them to provide their INR. So when families call for respite, not only do they get respite services, but they also are led into, they might be eligible for developmental disability services, where they might be eligible for preventive services, where they might be eligible for any other services across the state. So we think that's real important, and believe OASIS has provided a really good base for our intake. And if they have a problem, OASIS is available to assist or refer the caregiver to the appropriate approver. There are like 4 approvers of these funds that come into Oklahoma, and also the number for the finance division in DHS is we have their phone number on every piece of paper that goes out to families. So if there's a problem with issuing or paying a respite voucher, that phone number is available, and Mary is always available to talk to them about that. One of the other things is that by doing this, we've not set up a separate respite program with staff. When we get money, Department of Human Services acts as our fiscal intermediary, and we'll get into that in a little bit more. But when we get money for respite, every dollar of that goes into respite vouchers. So we don't take out an administrative fee. Department of Human Services doesn't take out an administrative fee or doesn't take out any kind of service charge on any of this. So if we get $500,000 from somebody, $500,000 goes into respite. Next slide. We don't do a lot of breaking ours up by disability, but you can see our aging community is by far one of our largest users, but it's also where we have the most money. So that's a little deceptive in that there's a lot of need down with DDSD. Marriage Initiative dollars is all children with any type of disability, and family support are for children who are receiving at least $1 of supplemental security income. And DDSD, of course, we do birth all the way through, but it is only for people that have developmental disabilities. There's also some money for mental illness through the mental health and some child abuse preventive services through the health department. To go to the next slide. This is our ages that we do, and I think it's real interesting in Oklahoma that our youngest recipient is 32 weeks, and our oldest recipient is 103. So I think we qualify for Lifespan. But you can see just by the way this folds out where the money is and where the money ain't. The biggest gap that we have and the hardest trouble we have is that 18 to 55 age group. We can find money for children. We can find money for people over 55. But, boy, we just have a horrible time with that gap. And that's why we're so excited about the Lifespan Respite Act and the possibility of getting money. Even though we didn't get a grant this year, we'll get one. So, next slide. So the people who are eligible for our program are grandparents over the age of 55 raising a grandchild with a disability. Now, if the grandparent is under 55, that grandchild has to have a disability to qualify for one of the other funding sources. And, of course, family caregivers over age 60 that are taking care of spouses or adult children, other relatives. So we cover that, Alzheimer's, dementia, other conditions. We also have money from kids who used to be in the custody of the Department of Human Services that had special health care needs and are now adopted, and we continue to support those adoptive families. Next slide. Okay. And anybody with a developmental disability not receiving any of our waiver services, or we have a family support subsidy, and if they're receiving those, we really have our voucher program designed to serve those families really not receiving any other services, so we can help them until they qualify for something else. And again, for children receiving SSI through our Disabled Children's Program here at DHS, and two-parent families that have a child with any type of developmental disability is in there. Next slide. We don't have a formal training packet or certification process. We really do honor family caregivers as the expert trainer. And when we talked to a lot of families, they didn't want, quote-unquote, respite training. They wanted training that was specific to their loved one's disability. So we formed a training coalition. We got the Department of Human Services, which includes developmental disabilities. It includes aging. It includes our Family Support Division. We got the Department of Health, the Department of Rehab, and the Department of Mental Health to agree to provide any training to either a family caregiver or the providers at no cost. So if they wanted a little bit of training in lifting somebody with a disability or caring for somebody with a mental illness, we could send them to specific training. And the caregivers could also use their voucher dollars to pay for provider time while training. Next slide. So we use DHS as our fiscal intermediary, and they receive all the funds. They put them in a special account, and we even place them in interest-bearing accounts so that
they told me they didn't.
They pull money in even while it's sitting there in the bank waiting to be used. So we're using the Older Americans Act, Maternal Child Health Funds. We get TANF, Maintenance of Effort Funds, adoptions and foster parent funds, mental health systems of care, and then our state funding streams is we do get state dollars from the Aging Services Division, Developmental Disabilities Services Division, and Family Support. So DHS, acting as our fiscal intermediary, brings the money in and donates Respite is just part of my time. We have a full-time respite coordinator in aging, and we have funded 2 positions at Oasis to act as our respite resource coordinators and to help people get through. Okay, that's as quick and as much as I can jam in 10 minutes, okay?
Thank you so much, Roseanne. That was very, very helpful.
Thank you.
Again, I want to remind people to keep your phones muted. And also, if you've got questions, if you're thinking of questions as they come up, you may type them into the message box at the bottom of your control panel, which you can minimize or maximize by clicking those double arrows at the top of the grab bar that you should see in your right-hand corner. And we will get to those questions as soon as I'm done with my presentation here. So we should have plenty of time for questions at the end. I wanted to just talk a little bit about the road that led us to federal legislation and through the legislative process. And as you can see from this picture, it was somewhat of a long and bumpy road, but we did eventually reach and successfully reach the end of it. And this was due largely because of all the tremendous advocacy efforts that went on because of the introduction of this bill. Even before the introduction of the bill, we looked to these state programs that were already up and running and were quite successful and thought, well, why don't we try to duplicate this nationally if it's working so well in these other states? And we pulled together many, many other national organizations. There were over 80 national organizations that supported the initial legislation, as well as over 300 state and local groups that worked with us. Beginning in 2000 is when we really started developing national coalitions to look to the vision of expanding lifespan respite nationally. It took us several Congresses to get the bill through, despite all of our support, but it was signed into law in December of 2006. As I said, this was not a concept that we pulled out of thin air. It was based on these model state programs that had already been recognized by other national entities. And I think the most exciting thing about Lifespan Respite is that it has as its focus, a single and sole focus, respite care, to not only help families pay for respite services, but to build capacity for respite, to establish respite as a national priority and as a national policy. What the law does directly is provide competitive state grants for the following uses of funds. And when I talk about competitive state grants, that actually means that states must compete for the pot of dollars that Congress makes available. It's not a formula grant. States don't automatically get funds based on their population or on what their respite needs are. They must compete in an annual process with other states. And that's simply because of the limited funds that are available. The next few topics I'm going to be talking about are mandatory uses of the funds as defined in the law. And folks cringe, especially states cringe when they hear the use, the federal government is saying there's some mandatory use of the funds. But in fact, there's a lot of flexibility here. And you heard, even among the 3 programs that have been around for a while, considerable amount of diversity, especially in their infrastructure. You know, whether it's localized in Oregon into 22 different programs, or 6 regions in Nebraska, or Oklahoma, where they do it all from the state level. There's a lot of flexibility for how states can design those systems. But the one thing they must do with the money is develop or enhance these state and local lifespan respite systems. That's at the core of the legislation. Once they've done that, or can demonstrate that they've done it, they can use those dollars to provide planned or emergency respite. And that's all the law really says. So that means they can use the dollars for vouchers. They can use the dollars to build new programs. It's, again, fairly flexible. And when we're saying provision of planned or emergency respite for all ages. Please don't forget to *6 your phone. Again, most importantly, what the law requires is that there be some focus with the dollars that the state receives to train and recruit providers and volunteers. Again, because while it may not be a huge problem in one state, in most states it is a huge problem. The families just simply can't find the providers or the programs that they need at the times that they need them, and the types that they might need. For example, a family might want an in-home provider 1 week so that they can go out and take care of things outside the home. Another week, they, for the same person that they're caring for, may prefer that their loved one go out for a while so they can stay home and clean the house or take a bath or whatever they choose to do at home, but that there are different needs for different types of respite, even over the course of a year or two. And finally, a mandatory use of funds is that states must provide information to caregivers about available respite and support services and assist them in gaining access to such services. It's not meant just to be a purely information and referral service. It's meant to actually be a direct help to an individual family to help them find the providers they need and to find the payment sources that they need. The program announcement that came out in fiscal year 2009, the first year of funding, AOA, which is the federal administering agency, made it quite clear that lifespan respite programs must advance their state's ability to meet respite needs. That means they must go beyond what they're currently doing for respite. In a state like Oklahoma or Nebraska, which already has a lifespan respite program, they've got to take it a step further and do more than they're currently doing. If they're starting from scratch and don't have any kind of system or even very few respite programs, they at least have to demonstrate that they will use these dollars to move beyond where they are currently. One of the most important things that states must do is serve all population and disability groups from the very beginning. There really cannot be any phase-in of just the aging population or just children. It's got to be across disability groups. Now, this doesn't mean you have to provide, $8,000 worth of respite to every family that crosses your border, because that's impossible. But you at least have to have a system in place that will assist those families in moving in the right direction and accessing the respite that they need. Programs must coordinate with and on behalf of existing respite programs and infrastructures. They must have a consumer focus, which is very important as we move toward more and more toward the concept of consumer direction in home and community-based services. There have even been studies that have shown that when families are using consumer-directed respite services, they're much more satisfied with the care that they're getting. And ultimately, they have to demonstrate stakeholder collaboration. Even in some of the grant applications that we saw last year, we saw states that had sign-ons from all of the state agencies. Even if there was one agency designated as the lead, which there has to be, that lead agency had letters of support from other state agencies in this effort. Who is eligible for lifespan respite under the law? Well, Congress intended pretty much that every family caregiver be eligible. Family members of any age. We made that clear so that we were also talking about young caregivers. You may have seen recent national studies that have shown there are, children under the age of 18 who sometimes are providing care to their parent with MS or their grandparent with physical disabilities. So they're included as a caregiver in this definition as well. Foster parents or other adults who are providing unpaid care. And the only reason unpaid is in there is to distinguish this from professional paid caregivers. It's not meant to exclude caregivers, for example, that might be getting paid some stipend through the care recipient's money follows the person, or a state program that actually does give the family caregiver some dollars to stay at home. It's not meant to exclude those individuals, but simply paid professional caregivers. And again, those caregivers who are providing care to adults and children of all ages with all special needs. The eligible state entities, again, there's a fair amount of flexibility here. The eligible lead agency, that is the agency that will make applications to the federal government, can be the State Unit on Aging, the State Medicaid Agency, or another state agency that's designated by the governor. But that state lead agency must do the application as well as implementation of the program in concert with an Aging and Disability Resource Center. And I know many of you on the line are Aging and Disability Resource Centers, so you know what you do. But for those of you who are not familiar with Aging and Disability Resource Centers, for the most part, they're federally funded entities that are, their main goal is to be the single point of entry for all long-term care services and supports, again, for families of all ages. Some of them are funded or initially were funded to begin serving only the aging population with phase-ins of different disability groups, but ultimately they share the same philosophy with Lifespan Respite Programs, that they're meant to be lifespan in the services and the linkages and the partnerships that they're putting in place to provide all of the services across the board. And the state agency must also work in collaboration with the State Lifespan Respite Coalition or State Respite Coalition or another state agency that has expertise in respite service delivery.
Yep.
As many of you know, the law was passed in 2006, but there was no funding in fiscal year 2007 or 2008. We received first-time funding in 2009 of $2.5 million. With those funds, 12 new state grantees were announced at the end of September, and they immediately began their program implementation. These states are, if you're from one of them, you might be pleased to know that Alabama, Arizona, Connecticut, District of Columbia, Illinois, Nevada, New Hampshire, North Carolina, Rhode Island, South Carolina, Tennessee, and Texas all received fiscal year 09 grants last September. And they're all very much in the beginning phases of implementing those programs. If you'd like more information about what they're planning to do, you can access their abstracts at this website on the AOA.gov Lifespan Respite site. We have them also posted on the Arch Respite site. And don't worry about quickly writing down all these sites. These slides, as well as all the background materials, will be posted on the Arch Respite website, and I'll give you that address at the end of the presentation. Some of the very generalized activities that the grantees are engaging in or planning to engage in this year include, again, some of the things that are central to the principles of lifespan respite, beginning to identify and centralize caregiver training resources in the state, the ability to coordinate emergency respite with programs like Adult Protective Services. That's a new partner for many states. Maybe you haven't thought about partnering with your protective agencies, but that's a critical population for which respite services can really mean the difference between a crisis and a positive outcome. There's a lot of time being spent on connecting the State Respite Coalition to the work of the Aging and Disability Resource Centers. There's a lot of wonderful partnerships that can happen there, and states are working on developing those. The creation of statewide 800 respite numbers, so there's just one number, whether it goes through the ADRC or goes through the State Respite Coalition or through the state agency, that there'll be one number that families have to call to find respite or a respite provider or other information related to respite. Some states are working very creatively through their Aging and Disability Resource Centers or other existing types of infrastructures that may already exist in the state to develop a portal to provide the respite care network information through that portal. Modifying existing direct support training models for use with respite providers to make them, to expand the numbers of providers that are in the state. And one state is even in the process of creating a statewide respite coordination center, which will be known statewide as the place to get your respite information. So what's happening right now? Well, in this current fiscal year 2010, Congress appropriated another $2.5 million for this current fiscal year. AOA is working right now on developing that program announcement, and we expect that to come out in early April. We're going to talk now a little bit about what it is you need to do, whether you're a state agency or a community-based program or even a family caregiver, how you might participate in getting ready to help your state apply for funding, or help if you're in a state that already has a Lifespan Respite grant, how you can help build what's happening or help monitor what's happening. And to do that, there are just some very basic questions that help people focus on what it is they need to do in a collaborative way. And of course, the first one is, what should our state Lifespan Respite System look like, and what should it provide? And today, you were lucky enough to hear from three model states about how they run their programs, how they set up their infrastructure, whether they focus on vouchers or doing it very locally like they do in Oregon to make sure that families have respite. There are different systems, and each system is unique to the specific needs of that state. And so it's really important for everyone to have some input into what they think their Lifespan Respite System should look like, and specifically what services should it provide, while also thinking about what they have to do with the federal dollars that they've been given. If you're in a state that has a state respite coalition, how do we strengthen that coalition? How do we reach out and make sure we have a really diverse and broad-based membership? Are there people at the table who are not at the table who should be, that we need to go out and find? If we're building a coalition from the beginning, how do we start that? How do we go about finding our partners? What do we focus on? And that's something that also that ARCH, as the Training and Technical Assistance Center, is more than happy to help you do and help you with. It's the very beginning of the process of thinking about federal funding. And then finally, once you've got your coalition, what role should the coalition play? And I'm going to talk more about that in a minute. Also, what will be the role of the Aging and Disability Resource Center? Again, the Aging and Disability Resource Center, all the law says is that it must work in collaboration with the state agency. It doesn't say exactly how or why. And so it's going to very much depend on every state and where their Aging and Disability Resource Center is in their own planning process. Some states, for the first time, got a grant to establish an ADRC, so it's very much in the infancy stages, and it's a great opportunity to build your Lifespan Respite program along with your ADRC. Some ADRCs have been around since 2003 when the first grants were given out, and they already have a superior mechanism in place for and a superior databases that they've built, and they can look to the Respite Coalition or the State Respite Organization to provide that respite expertise, but be the main focus of where families are going to find their respite. And then, ultimately, what are the short and long-term goals we need to reach to become a Lifespan Respite? And that refers back to your first three questions, defining what the system should be, what should it look like, what services should we have, what are the roles of the different players and the different stakeholders, and, ultimately, even let's make sure we have all the stakeholders at the table when we sit down to do this plan. I'm going to talk specifically for just a minute about State Respite Coalition, because it is specifically mentioned in the law that the state's application must include a memorandum of agreement regarding the joint responsibility for the eligible state agency's program, that there has to be an agreement that stipulates exactly what that relationship is going to be between the state agency and the Respite Coalition. For those of you who are not familiar with state respite coalitions, there are probably respite coalitions in at least half the states right now. And they all, again, just like some of the Lifespan programs, have had very different things that they have focused on, or depending on whether they have paid staff, or if they're formalized into a 501c3, or if they're more loosely knit. But all of them, to some level, have been very much engaged in advocacy efforts, being the respite voice in the state across ages and disabilities. They play a very important role in terms of networking, what's going on with the best practices in our state around respite, networking to build respite databases. Some of them have gone further and taken upon themselves to be the experts in the state on provider recruitment and training so that the state agency looks to them for guidance in this area. Some of them are simply there as information and referral sources to help families find respite. Many of them do their own fundraising to keep their coalitions going, or also to directly support respite programs in their state. And some have raised so much money that they decided to do voucher programs to actually assist families in paying for respite, especially the GAP populations who are not being served by any state or federal program. So their roles basically can stay the same in the new, within the context of Lifespan Respite, or there are new opportunities for coalitions as well. Again, they can be the main portal for respite referrals in a lifespan respite planning sense. They can be the folks who are best prepared to build the respite databases or work with states. Some of them are working very much with state agencies to help them build state task forces and state advisory groups. The role of the ADRCs, again, some states are still defining what those roles will be. Others have very much looked to their ADRCs to help them do outreach, to do respite information, to be the respite information clearinghouse and help disseminate information. Many of them already have some caregiver component to them, and so may be most likely to be the folks who are going to help with caregiver training, looking to the Respite Coalition or the respite experts for developing those training needs around respite in particular. Being the place which houses the respite hotline, or simply working an advisory role or being partners in doing public awareness or program administration overall. So again, just to summarize, and in conclusion, as you're all thinking about, where is my own state in this process and how can I be involved, regardless of, again, whether you're a state agency or a community-based organization or a respite provider or a family caregiver, it's all about developing relationships so that you can enhance collaboration within your state coalitions, with your state respite coalition, with the governor's office, who will ultimately decide who is the state lead agency. Very important to begin to know who are the folks in our state agencies who are responsible for state respite program delivery and services, and really taking the time to build those relationships, because sometimes they're not easy to build. It's sometimes hard to even identify who all the stakeholders are, but that's an initial and a very important first step. And then there are many pieces of the actual application itself that are going to require a lot of information gathering, because the application asks for, the current state of respite in your state. What are the needs? What are the barriers? How many family caregivers do you have? What are the funding sources that you currently use? And so there's a lot of information gathering that needs to be done before you even sit down to write the application. And that can be, either a job for the State Respite Coalition or the state agency working with the coalition or whomever. But there are issues that you need to start thinking about before the next program announcement even comes out. And again, the ultimate goal is so that there is collaboration in not only serving the population that's out there, but in designing the program so that everyone feels like they had a voice in how the program develops and how it will be implemented, and have a voice in what should this program look like. So I hope that this information was very helpful for you today. These are just some of the supporting documents that might be of use to you. And again, most of them are located on the archrespite.org page, which if you scroll down on the left-hand side, you'll see Lifespan Respite Training NTA, and it will take you to the page where all of these documents are listed. But we will be archiving this webinar as well as these other supportive materials that were referred to during the presentations, and we'll be sending that around to you so you can much more easily access this. But again, I wish you all good luck as you move forward with Lifespan Respite, and hope that you will look to all of us at Arch and Greg Link at Aging, who's very available to people to answer questions. And if anyone has questions now, we can move to answering those. Emily, did we receive any?
Mute off.
Hi, Jill. Yeah, we did receive a few.
Emily's going to read those questions now. If you find that you didn't have a chance to type in your question, do it now. We have about 15 minutes to start answering them. If we don't get to your question, please email me at jbkagan@verizon.net or give me a call, and I will either answer the question or forward it to the presenter who can best answer it. So go ahead, Emily.
Okay, first is from Maggie Edgar. She asked, can any of the presenters talk about implementation of their Lifespan Respite Program help leverage additional funds from other state or private sources that perhaps were not even used for respite previously?
Marcia, why don't you start with that one?
Okay. Well, in Nebraska, our respite coalition was very instrumental in working with our legislature and getting our the money or the bill passed. And we were able to leverage the tobacco fund monies, tobacco settlement monies, to pay for respite itself and also for part of the network. And we were able to leverage some money from the IDEA program through Department of Education, which was not being used for respite.
Roseanne, do you have a response to that question?
Well, I mean, we started off by building a coalition and just trying to figure out who across the state had funds. And we used ARC's funding guidelines to see what money was coming into the state. Then we found those trails, came into Oklahoma, and made sure that any of those people were part of our respite coalition. And then we just asked people to give us seed money, you know, put something on the table so we can show you how well this will work. DDSD came forward with the initial dollars. We got a private grant from the Zero Foundation in Tulsa, and Aging came up a little bit just to show that vouchering would work, and that's the only thing we do. We issue vouchers, parents or caregivers find their own. Caregivers set the rate of pay and send the vouchers back into DHS, and we send the provider a check. So we just went around looking where the money came in to Oklahoma for children, for adults, for foster kids, for, I mean, just this year we started a pilot, you know, with foster parents. And now foster care is coming on board because they saw the need for foster parents. So it's just continuing to look to see what needs are out there. We go out and do family forums. We speak at statewide conferences to try to go out and find out what people are needing and to find those additional people you need to bring to the table. And as new money becomes available, then you keep seeking out new people. Does that help?
Yeah, I also heard your state family caregiver support person once tell me many years ago, she said, we were so lucky to have the Oklahoma Lifespan Respite Program in place so that when we got dollars from the National Family Caregiver Support Program, we knew we could just plug them in and get respite dollars right to families immediately.
Yeah, because Aging put forward about $50,000, you know, to do a little pilot. DDSD put up about $50,000. We had some money to show that this worked, and we did a survey immediately to show the results of the families and how they felt about it. So we had people sold on it by the time kind of big chunks of money became available, and that was very good for us.
Any similar things to add? May, are you still there?
Sorry, I was on mute. I think Oregon has some different challenges, and I've only been with the program since 2008, but we have different challenges to address. But definitely researching various funding sources and educating the local network what they are has been a challenge, so that they know to refer families to. So we're addressing it.
I know the original thought behind the need for very localized partnerships were that the local folks would really know best where the local dollars were and would be best at being able to identify those and perhaps leverage them, new dollars that haven't previously been used. Do you think that's still how some of them are functioning?
It's still
or at
in
least
some
that's
areas,
the intent.
and yeah, that was the intent. Still in some areas and not in some others, and again, it's based on how much each one of those networks gets funded and what is the FTE of the local coordinator, and often they're not full-time, and it's difficult to go out there and collaborate and partnering with the partners all the time. And they do try, though. And you're right, to make the program work well, they have to. That's the number one collaboration. Number one requirement.
Next question, Emily. Thank you, May.
Yes, this one comes from Terry Wilson. She asks for the entire panel, how has the fiscal climate impacted current AOA-funded projects and ongoing community state activities around lifespan respite?
Anybody want to take a crack at that?
Well, this is Greg at AOA. I mean, we hear on a regular basis the challenges that many states are facing as a result of the fiscal climate. One of the things that we heard, that I heard, was that meeting match requirements. There is a mandatory 25% match to draw down lifespan respite care funds, and I know that states last year considering applying, being able to meet that match was a definite consideration. I would say to that the match can be, cash or non-federal cash or in-kind sources, so looking to those combinations to meet the match requirement. But I think that, lifespan respite has the opportunity or the potential, at least as far as respite dollars are concerned, to provide a mechanism to evaluate what's out there and to ensure that that every dollar that's available for respite is being targeted to the in the most efficient way to those people who need it.
Yeah, I have found too, just in talking to some states that did not apply last year, that were concerned because of the staff cutbacks that they had, statewide last year, didn't even have the staff to apply for the grant. I've heard since then that those states are going to be applying this year, so that's a positive thing that things are looking up. But it's also just incredible that even though it's such a small pot of money that you're getting from the federal government, it may not seem like it's worth it, but it's really amazing when I look at the federal grants that were written and talk to the state agencies that are implementing it, the incredible things that they're beginning to do even with that little bit of money. It's a start and it's a beginning, and it can help stimulate and, again, help recognize respite as the important service that it is. So it's definitely worth even the small pot of money that's available. Any more questions? Or anybody else want to respond to that? Any other questions, Emily?
Yes. Karen Iovino asks, are lifespan respite programs required to undertake all of their efforts on a statewide basis, for example, across the entire state from the outset, or may that work be developed over time?
Do you want to get that, Greg?
Greg at AOA. Yes, they would be required to implement statewide.
Can they have a plan to implement statewide, that they will start working on their plan from the get-go?
Oh, sure,
Yeah.
sure. But the intent is that the lifespan program, the respite program, be available statewide.
Right. That is fairly clear in the law itself. Any more questions?
Yes. Karen also asks, she's looking into services tailored to youth caregivers, and she's looking for more specifics on any respite services that are available to them.
Well, that's a very good question.
Yeah. I would say that, I mean, is it federal sources of funding for youth caregivers? Or is it just, or perhaps the availability of youth respite services in her particular state? If it's that, I would say, that at least beginning at the state level to talk to some of the health and human services agencies that may fund respite to find out if there are specialized programs for young caregivers.
I believe there might be a model program in Florida.
There is.
And if she would email me directly, I would be happy to track that down and get more information about it in the Broward County area. And if there are other people know about such programs, to also email us, and we will have expanded our knowledge base as well. Next question.
Next one comes from Marilyn Maxwell and Mark Keeley. They both ask, who are the 12 new federal grantees referenced in the introduction?
I did have a slide on that state. Let me go back to that one. Whoops. These are the 12 states, if they're still on the line. And there you can find out more information about what they're doing at the AOA website, and as well as at the ARCH Respite Lifespan Training and TA page. There's some short page description of each of the grantees. Next question.
Alan Factor writes, do Oregon, Nebraska, or Oklahoma have any data on market penetration since their state program started? That is based on the number of families providing unpaid care. How many families have applied for respite care, and how many are receiving government-funded services? He also wants to know how many were referred to private pay services because they were not financially eligible for any public program.
In Oregon, we are working on our data collection system to better collect that type of data.
Marsha or Roseanne?
I was trying to think of quite a question. We're not market penetration. These social workers don't think like that. But we have, been able to increase a little bit each year. Now, with the real budget crunch this year, we didn't grow any, and we're probably going to lose 5% next year. But we're still being able to serve between 4,000 to 6,000 people a year. And ours is, our eligibility, there's no income, eligibility for aging, so they can make anything. Most of the others on ours, we have an income of like under $60,000, and we felt like that was pretty generous. Hey, it's way above poverty. It's, it's way above the 300% of SSI. Because we knew that the families, making between $32,000 and $65,000 a year are the ones worst hit because they usually don't qualify for the program. By going through OASIS, we do try to refer families to any other program they might be qualified for, but we don't really collect data separately to really look at that. So I'm afraid I'm going to bomb out on your question.
Well, I think the answer, too, is that, not only are the Lifespan Respite programs hooking people up to existing federal and state funding sources, but they maintain or try to maintain respite registries of all the providers that they know of in their state. I know a lot of the new grantees are spending a lot of time building those registries to be very complete so that they will be able to refer people to private paying providers if that becomes an issue. But someone first has to be there to collect all that information and develop those respite registries.
Yeah, this is Marcia, and for Nebraska, we did collect some data last year on our public awareness campaigns, and it was estimated that we reached 230,000 individuals through our TV, newspaper articles and ads, health fairs, and other community programs, conferences, at booths and things like that. last year. And then we do have a registry where we have 1,081 providers listed on our registry.
Right. And those are individual providers as well as programs.
Right. And 830 of that is individual providers.
Right.
You know, in Oklahoma, we tried to develop a provider registry, but, you know, liability issues really became an issue, and we didn't have any administrative dollars to complete background checks and to do all those things that you have to do to kind of protect yourself legally. And so we really just kind of talked, you know, family to family, refer them to some other folks, and refer them to different places to find, you know, a respite care provider if we can't, you know, do that. But we found that we only get about 5% of our calls are from people who can't find anybody to take care of their loved one. So it's really been a fairly minor issue here in Oklahoma.
Let's take one more question, and then I'm afraid we'll have to conclude.
Okay, last question. Judith Bowen, she asked Oklahoma, do you use FCSP money for grandparents 55 and older raising grandchildren who are not disabled?
What money?
FCSP.
Is that the support,
I think she
the
probably
family caregiver support program?
Yes.
3E, yes.
Okay. And do we use that? Yeah, a grandparent raising a grandchild, they don't care if they have any disability at all. It's just a grandparent raising a grandchild, any grandchild. If that grandparent is under 55, they no longer meet the criteria of the Older Americans Act. So we pick them up in other funding sources that we have, and then those kids have to meet the qualification of the other criteria for the funding.
Nebraska is the same as Oklahoma. Those funds are used here too.
Yeah.
Okay, thank you all very much. If for some reason your question was not fully answered or we did not get to your question, I apologize. Send it on to me and at that address, jbkagan@verizon.net, and I will forward it to the correct presenter to answer your question. And I want to thank everybody, all our presenters. They did a fabulous job, and Greg for joining us from AOA, and Emily for keeping us all on track with the technology. Thank you all very, very much. And again, contact me at any time if you have any follow-up questions. And thank you for joining us today. That's the end of our webinar.